Next, for the integument or integumentary system. First, we have the subcutis um, of the various sarcomas, fibromas, and myxomas are encountered in the subcutaneous features of infants. Many may be included by avian necrosis viruses, although some of these tumors are reported from SPF hens and other poultry species. Chicken systematically infected by some retroviruses may produce tumors in response to the inflammation associated with wounds, as postulated to be the cause of some mesenchymal tumors observed with the cream feet of the hens. So, madami talagang nakukuha from creaming the feet of hen or other avian species. First, we have the hemangioparasitoma. A few hemangioparasitomas have been described in chickens. They were all benign lang siya, and nag-occur siya sa subcutaneous nodules in the cervical region. Histologically, they were arranged as concentric rings around blood vessels, and they were composed of uniform spindle-shaped cells with fusiform nucleus. So this is a spindle-shaped hemangioparasitoma with a concentric rings. Diba? All sites clearly defined. Next.
Next is the lipoma and liposarcoma, which is very common in chickens. They are benign and they are encapsulated and delicately trabeculated and may exhibit necrosis or hemorrhage. They are composed of large, mature, vacuolated adipocytes with pale displaced nucleus. Mitotic figures are rare. Sa liposarcoma naman, in chickens are very rare and may be locally invasive or metastasize. In some cases, the predominant cells are elongated and may be mistaken for fibrocytes maliban lang sa presence ng small cytoplasmic fat vacuoles. Others are composed of more typical immature adipocytes.
Next, sa cuties naman tayo. First are the squamous cell carcinoma. These squamous cell carcinomas, the true squamous cell carcinomas of the skin of birds originates from surface epidermis, form sila ng infiltrating hordes of anaplasmic keratinocytes that invade downward into the underlying dermis. The epithelial cells are also separated by intracellular bridges and resemble cells of the stratum spinosum. These tumors are locally invasive, but only a few have been metastatic. The tumors, originally described as thermal squamous cell carcinomas in young broiler chickens, have been redesignated as avian keratoacanthoma due to origin from feather. So, parang redesigned lang siya as avian keratoacanthomas. They're rather than the surface epidermis. Oropharyngeal, esophageal, and inglovial squamous cell carcinomas also have been recognized, especially in chickens. Next. This picture, so first, Letter A, a cytological features of the mass balloon-like colorless vacuoles interspersed with the nucleated red blood cells. So, meron siyang cutaneous na parang balloon-like na ano. So, ito yung sa second picture sa letter D, and letter C, there is a parang ano siya, it is pale and a very large mass. And sa letter D, it is a deep lipoma and cut surface of deep lipoma of the liver of a local bird. Next.
Avian keratoacanthomas. So, ito yung sinasabi kanina ni Ethylene na redesign or redesignated mula sa squamous cell carcinoma. Avian keratoacanthomas are mostly or commonly found in the skin of tumors. These tumors were formerly designated as dermal squamous cell carcinoma, but avian keratoacanthoma was selected as more descriptive term dahil yung tumors unaltered by the processing artifacts of the feathering and scalding have the distinctive tissue architecture of keratoacanthoma. So mas um mas pasok siya sa term na yon. Originate from feather follicle epithelium rather than the surface epidermis. Are not metastatic, and in live birds, nagre-regress siya. Prevalence of broiler carcasses with multiple lesions varies from 0.01% to 0.05%, but may be higher in individual flocks. Ito siya. Dito sa first figure, typical carcass lesions of avian keratoacanthomas are craterous ulcers within feather tracts. Ito. Tapos, sa second figure naman, sa live chickens, ulcerative lesions contain central masses that are mixtures of keratin, cell debris, and bacteria. Ito siya. Very dito sa third figure, early keratoacanthoma lesions in the skin of live chickens. Nodule siya sa base of feather follicles. In some studies, chickens slaughtered at less than 48 days. Yung chickens daw na slaughter in less than 48 days of age, mas maraming tumors than older birds. And tumor prevalence was cyclic, being lowest in summer months. In other surveys naman, an increased number of condemnations due to these tumors were associated with dusty houses, bird placed in new houses, or certain farms. Carcasses most commonly exhibit crater-shaped ulcers with raised margins, but nodular ulcerative lesions may be present, kagaya ng nakita sa figures kanina. Ulcers are composed of a central cup-shaped cavity lined by epithelium and filled with keratin, bacteria, and cell debris. Post-slaughter, the feathering often alters the lesions, and all lesions eventually regress. So, nawawala din yung mga lesions. Next.
Next is the feather folliculoma. Multiple cystic structures found on the medial Pieces of the wings of the adult hens have been described. These cysts were filled with keratin and feather remnants. They were lined by squamous epithelial cells. In some areas, there was abrupt keratinization of the lining epithelium. Sa iba naman, merong disorganized feather follicle epithelium, and there was an intense inflammatory action in the adjacent dermis. Similar cysts is also described sa turkeys. Next. So, this is a example of a feather folliculoma. As we can see, there is a um, inflammatory reaction and disorganized feather follicle epithelium. So, parang hindi sila dapat isang direction lang sana, but magkakaiba-iba. Next.
Next, intracutaneous keratinizing epithelioma. These benign masses were characterized by multiple nodules in the facial skin of adult hens, each marked by a central pole. So, yung mga nodules na yon may central pore sila. These cysts are lined by stratified squamous epithelium with orderly maturation from a peripheral basal layer. Yung cyst ng lumen, nagko-contain siya ng lamellated keratin pero walang feather remnants, di kagaya ng kanina. There are little inflammation lang surrounded this cyst unless there was a rupture of cyst wall. So, hindi malala yung inflammation na nag-occur. So, dito, sa figure, the lumen of this intracutaneous keratinizing epithelioma contains lamellated keratin. The epithelium shows basal cells aligned on a distinct basal lamina in progression to polyhedral cells with abrupt keratination. Note the small intraepithelial bulla. Next.
Punta naman tayo sa musculoskeletal system. First, we have the rhabdomyoma and rhabdomyosarcoma. Rhabdomyomas and rhabdomyosarcomas have been seen in chickens. They primarily nag-affect sila sa skeletal muscle of the breast. So, sa pectoralis and legs, and then commonly sa musculature of the hearts. They are usually histologically characterized by a spindle, crack, flame, or bracket cells, and multinucleated cells. For immunohistochemical examinations, for vimentin, myoglobin, specific actin, and desmin have been useful in some cases. So in this figure, it is a rhabdomyosarcoma. Some cells are struck-like, whereas others are large and polyhedral. The cytoplasm is eosinophilic and some cells contain multiple nuclei.
Next. For the other tumors, we have multicentric histiocytosis and yun. Multicentric histiocytosis is a systemic spindle cell proliferative disease that affects yung mga young broiler chickens na nagpo-produce din ng hepatomegaly and splenomegaly. Numerous cells, white masses are grossly evident in spleen, liver, and kidneys. Yung mga Affected birds or poultry are pale or anemic and have smaller than flock mates. Mas maliliit sila kaysa sa mga kasama nila. So microscopically, nodules of spindle-shaped cells replace the spleen, liver, kidneys, and other organs. Spindle cells contain abundant eosinophilic cytoplasm and elongated ovoid tumor pleomorphic nuclei. Dito sa figure, in multicentric histiocytosis, nodular masses of spindle-shaped cells multifocally replace the spleen.
For the diagnosis, immunohistochemical techniques such as vimenidine, cytokeratin, and immunofilament have been used to identify tumor cells. However, some antibodies may exhibit different activity in avian tumors than in mammalian species. A careful evaluation of the antibody in both normal and neoplastic tissues of the affected species is important for accurate interpretation of the immunohistochemical findings.
So for treatment, prevention, and control, wala siyang specific treatment kasi hindi rin nasabi yung mga specific causes ng mga tumors. Pwede lang gawin ay supportive care. Yun.
And also, depende sa'yo kung ikakalmo na sila or pwede mo rin kainin kasi hindi naman yung iba ay sa report namin wala namang nasabing zoonotic yung tumors. Ano yung ba? Basta
Recording ko na naman.
tapos lang